Hello everyone. In this video, I am going to be talking about the Wells criteria for pulmonary embolism. This is very important. You'll see it a lot on your boards, on your rotations, and it's something that surprisingly a lot of physicians, or a lot of providers actually, not just physicians, but also including residents, AP, advanced practitioners, we all talk about getting a D-dimer, not getting a D-dimer, whether or not we just have to go straight to doing the CT angio or not. And I'm here to tell you that the answer is in the Wells criteria. So you don't have to really have this memorized. It is on MD Calc if you need it. Keep in mind that there is Wells criteria for pulmonary embolism, not to be confused with the Wells criteria for DVT, which is a separate calculator. But for the Wells criteria for pulmonary embolism, we'll go over the criteria in just a sec. But I wanted to mention that the formula is assessed on either a 3-tier model or a 2-tier model. Okay. And these tiers are based on the 2-tier models, based on whether or not you should order a D-dimer, whether you should just go straight to getting a CT angio. And then the 3-tier model is risk stratifying if the patient is low risk, moderate risk, or high risk. So let's go over each category and we'll talk about the point system and how it works, okay? So the first category is clinical signs and symptoms of DVT. If it's no, you get 0 points. If it's yes, you get +3. Is pulmonary embolism the number one diagnosis or equally likely? You get 0 points for no, obviously, and you get 0 points for all no's. So I'll just go straight to the yeses. The yes on this category would be +3. Is the heart rate greater than 100? If they're tachycardic, it's +1.5. If they are, if they've been immobilized for at least 3 days or surgery in the last 4 weeks, if that's a yes, you get +1.5. If you had a previous pulmonary embolism or a previous DVT, you've been objectively diagnosed with it on imaging or what have you, that's going to be a +1.5. Hemoptysis, another big one. And you'd be surprised. Patients with pulmonary embolism will cough up blood. Hemoptysis is a +1. And of course, cancer, we all have to be mindful of that. If they have a history of malignancy with treatment within the past 6 months, or they are palliative, that gets +1 as well. So let's go over, so we've gone over the scoring system here, and then we're going to talk about the tier models. So the 3-tier model, if you get a score of 0 to 1, it's low risk. And low risk means that there is a 1.3% prevalence. 2 to 6 would be moderate risk. Moderate risk having about a 16% prevalence or 16.2% prevalence. And then the greater than 6 would be the high risk, and that is like 37.5% prevalence. So the chance of you having a PE, if you score greater than 6, is quite high. And you might be thinking to yourself, 37 is, if you're not a doctor, you might be saying 37% is not high. Well, that's like over 1 1/3 chance that you might have a pulmonary embolism, and I don't necessarily want to play. I don't really necessarily want to play Russian roulette with these chances. Now, as far as the 2-tiered model, as we talked about, this is whether or not you should order a D-dimer or a CT angio. And I think this is a very useful test using the 2-tier model, because there are so many times in a rapid response or in an acute situation, you have to figure out whether or not to order a D-dimer or just go straight to the CT angio. The reason why this is important is because I can't tell you how many times you decide you need to order a D-dimer, or you're considering ordering a D-dimer, and the patient's kidneys are shot. They have chronic kidney disease, their GFR is like, I don't know, 25, or what have you. Their creatinine is 2 or 3, and well, you've ordered the D-dimer, did you even need to order the D-dimer? Because if you didn't, then you've dug yourself quite a hole. Because now that the D-dimer is high, which it was probably going to be elevated anyway because they are under stress, they are in the hospital, they might be septic, there might be something else going on. Well, their D-dimer is going to be high, and now you have to put this patient through IV contrast to get the diagnosis of a PE. So if the score, I don't know if I mentioned this before, but if the score is less than or equal to 4, then PE is unlikely. And if the score is greater than or equal to 5, then PE is likely. So what this means is that if the if the score is 4 or less, then you should probably consider doing a D-dimer. Score of 5 or more, go straight to CT angio. Okay, so that's pretty straightforward. And if you're not sure what to do with the D-dimer or the CT angio, don't worry about confusing yourself. You can just use the Wells criteria for PE and just be done with it. You don't have to think. I mean, you obviously have to think, but it at least puts a lot less stress on you, and makes things a little bit more algorithmic so that you don't have to worry about what exactly you need to be doing. And another thing that's interesting about the Wells criteria is that 20.4%, so a little over 1 in 5 patients who went to the CT angio did in fact have a diagnosis of a PE. And in the PE unlikely group, that is those who scored a 4 or less, those with a negative D-dimer and discharge to home had an incidence of missed PE on 3-month follow-up of 0.5%. So that means 1 out of 200 people you missed a PE if you follow this criteria. So those are pretty good chances. I mean, that's pretty good as far as a test or a criteria goes. But yeah, I mean, I just wanted to briefly talk about the Wells criteria because it is an important teaching point, given the fact that so many people order D-dimers and nobody, in a rapid response really knows what they're doing. It's important to be objective and to at least have something that you can hold on to during these stressful times to say, okay, well, do we even need the D-dimer? Maybe we can just go straight to the CT angio, because the D-dimer takes time, right? There's other risks to getting the D-dimer. You're delaying treatment if you don't need the D-dimer, and you need to go straight to the CT angio to prove it PE. If you didn't use the Wells criteria, well, maybe you delay treatment and you order the D-dimer, you have to wait for it to come back. Maybe the lab takes a while, and the patient is all the while struggling with this pulmonary embolism that you rather have just gone to a CT angio straight and gotten the diagnosis earlier. So what do you think about this test? What do you think about the Wells criteria? What do you think about ordering D-dimers? Let me know in the comments down below. And like and subscribe. See you later, everyone.